Well, we're very excited by the Nuffield Trust report. It's a really important piece of work because for the first time it's able to demonstrate how important home palliative care is, the sort of palliative care that Marie Curie Nursing Services provide. And so being able to demonstrate that not only more patients can die at home, which is actually where most people do want to die, but also we know that it reduces hospital admissions. They're much less likely to go to have an emergency admission or to go to A&E. So we feel that this information, this data that's been put together by Nuffield is incredibly helpful. And I think one of the great strengths of it is the scientific robustness, because it matched 30,000 of the patients accessing Marie Curie Nursing Services with 30,000 other patients matched on age, matched on diagnosis. So we can really compare the benefits of the nursing service versus not having the nursing service. I think progress has been made over the last few years to make sure that people do die where they prefer to, but there's a really long way to go. And I think that's down to a number of different factors. For a start, we know from the National Bereavement Survey that most people actually aren't asked where they would prefer to die. And even perhaps more worryingly, only a third of their relatives know that they are going to die before they die. So there's a real issue about communication and information, and there's a need for doctors, nurses, other health professionals, social workers to be much more confident in being able to talk to patients and their carers, their families, about death. It's obviously difficult. It's not something any of us would find very easy, but we need to make sure that we support all those professionals so that they can do it better. Because we know from feedback from patients and their families that they would have welcomed that conversation so much earlier. So until we crack that, then it's going to be very difficult to make sure that people do get the choice that they want at the end of their lives. And we at Marie Curie believe that they deserve to have that choice. Obviously, if we want to move things forward, and as I say, progress has been made. So, there's been a 2.5% increase in number of patients dying at home, which is to be welcomed. But if we're to do more than that, and given the fact that there will be a greater need because there will be more older people dying over the next years because of demographic changes, then we need to do a number of things. The first is to make sure that we join the services up as well as we can. There is still fragmentation of services, and too often the patient and indeed their family have to navigate their way through to make sure that they get what they need, which must be an incredible burden at such a difficult time. There's also a huge variation across the country about what is available. So not only do patients and families have to navigate, but what is available varies too. And then, of course, the cultural issue around making sure that people are able to have those conversations and people are able to say what their preferences are for the place of death is another important part of it. Commissioners play an incredibly important part. Obviously, they commission services, and so we would encourage them to work closely with organisations like Marie Curie, but also help the hospices, the National Council for Palliative Care, to make sure that we can work together. We can help them understand what the needs might be. We've recently done another piece of work called the Atlas of Need, which would be able to demonstrate to commissioners where the gaps are in services, as well as what the need is for their population. So there are a lot of things that we could do together, and that would be most welcome, and I think would improve end-of-life care for patients. I think it's been a very, very important piece of work. It made sure that people think about it now very explicitly, and it has led to improvements. So, one shouldn't knock the fact that a higher percentage of people are now able to die at home than were before, so that's great. But of course there's a lot to be done, and there'll be a refresh of the strategy in 2013, and that's an opportunity to look at not only what's worked well, because some things have, but also what more needs to be done.